These are questions that our physicians in our community are concerned about, issues that they need to be addressed on the congressional level, and where do you stand on these issues? I think that's extremely important for you to decide how you're going to vote, is to actually know where the candidates stand on the issues that are going to specifically affect you.
The Affordable Health Care Act doesn't look like it was put together by physicians, from as far as I can tell. It doesn't appear to create any additional value to the patient. It doesn't appear to have them served any better. And I would think as doctors, I never took the Hippocratic Oath, but it's about the patients. It's not about new HIPAA requirements. It's not about new electronic record requirements. It's about treating those that are in your care and being able to get them healthier in that home.
My point is, as has been said, you're not going to repeal it in the term that Obama is president, because it would take a 2/3 vote of both houses to override his veto. And the House has already voted some 54 times to repeal it without success, because it's just not going to happen in the present environment. So what I think we ought to do is stop talking about repealing it and instead talk about how we're going to amend and change and remove the unsavory provisions in the Act.
I think the medical malpractice caps are entirely appropriate to where you actually can afford medical malpractice insurance, to where your funds aren't being diverted from things that actually make sense, to diverting them to prevent the attacks from attorneys, or to cover the attacks from attorneys. But you know, we need to be looking at insurance, and we need to be looking at healthcare more holistically. The reality is that what's happening with healthcare now is we're clearly seeing government takeover. We're seeing federalization. What does that look like? Is this truly an experiment? I don't think it is. I think we've seen it with the Veterans Administration. I think that's exactly what it is. Whether it's electronic records compliance, whether it's having people that don't have your medical qualifications telling you what to do and what services to provide, what antidotes to provide to your patients. It's inappropriate.
People that could afford this would have the ability to go into a Medicaid program or into a welfare program. They could actually drop their insurance that they currently have with their employer and then go into this system. So the insurance companies of employers would lose, the insurance companies that already have group benefits, and then other employees are benefiting from these group benefit rates, and also the employer. If more people dropped out of those benefit rates, then those rates would go up. So it's going to cost, it's an increased cost to the insurance industry itself, and it's also an increased cost to the employers.
I know you have a lot of running around, a lot of questions, a lot of forums to choose from, and we greatly appreciate you being here, and look forward to whichever one of you is running for re-election to coming back in the future.